My name is Gilles Montalescot. I'm Professor of Cardiology at PTA Saint-Pétrière Hospital in Paris. So PCSK9 inhibitors are more and more important in the management of LDL cholesterol because clearly with the oral drugs that we have, many patients just do not reach the LDL targets that we all know. And this target, as you know, is 55 milligrams per deciliter for the patient with an ACS. And clearly, we estimate that only 30% of patients roughly get to this target. So we need PCSK9 inhibitors to reach these LDL targets, and we need to use more and more PCSK9 inhibitors just to get the prognosis of these patients improved. The two studies look at the ACS and MI patients, and they use PCSK9 inhibitors very early during the acute phase of the acute coronary syndrome. And the idea is to get LDL very low, rapidly, and persistently, because these two studies are going to have long follow-ups. And the expectation is to have a low LDL cholesterol from the beginning, the acute phase of myocardial infarction, to the end of follow-up. It's going to be 1 year for AMUNDSEN, 3 years for EVOLVE-MI. And it should improve the prognosis of this patient. That's the expectation. So what we expect is to show first that we have an efficacy on LDL cholesterol management in ACS and MI patients with this strategy of an early implementation of PCSK9 inhibition in the treatment of these ACS patients. And we expect to see a transition to the benefit in terms of clinical cardiovascular outcome. And if it is the case, it will change practice, of course, because nowadays we use PCSK9 inhibitors as a kind of third-line treatment after the use of all the oral drugs that we have to treat these patients. And now they could become a first-line treatment in the management of acute MI patients.